Let's discuss about polycystic ovarian syndrome or PCOS. PCOS is a hormonal disorder causing enlarged ovaries with small cysts on the outer edges. PCOS affects 1 in 10 women. PCOS seen in 12 to 21% of reproductive age women. 70% women with PCOS going undiagnosed. 50% women with PCOS who will develop type 2 diabetes before age 40. It affects 7% of women in adult age. Pathophysiology of PCOS is mainly from two perspectives in our body, such as insulin resistance and elevated luteinizing hormone and follicular stimulating hormone levels. The first one is insulin resistance. In insulin resistance, what happens is cells in our body fails to respond to insulin hormone to take up glucose for the use of energy. Because glucose is not using for energy, it stores in our body resulting in weight gain. And also excess insulin in body causes increased androgen and it leads to anovulation. The two hormone that causes changes in a woman's body is LH and FSH. These hormones are needed for reproduction. The luteinizing hormone helps in sexual development and functioning and also it controls the menstrual cycle. The follicular stimulating hormone helps in the stimulation of follicles. It causes maturation of the eggs and thereby release of the eggs. Balance between luteinizing hormone and follicular stimulating hormone is essential to avoid ovulation problems. In normal cases, at the initial stage of menstrual cycle, the FSH level is elevated than LH level. But in case of PCOS, it reverses. That is, the level of LH is increased than that of level of FSH. The increased luteinizing hormone causes androgen substrates to increase the production of testosterone and it causes excess facial hair. And the decreased FSH at the same time causes no stimulation for eggs maturation and thereby it leads to no ovulation and it causes difficulty to conceive and irregular periods. Factors for PCOS: weakened immune system, bad dietary choice, heredity, insulin resistance, obesity, high level of androgens and low grade inflammation are the main factors for PCOS. Symptoms of PCOS: irregular or prolonged periods, hirsutism, hair loss, menstrual cramps, acne, stress and depression, fatigue, pelvic pain, rapid weight gain and fluid filled sacs or cysts. PCOS versus PCOD. Or is PCOD and PCOS same? How are they different? First discuss about PCOD, that is polycystic ovarian disease. Less number of cysts on ovaries and it can be reversed. It does not cause fertility and most common and minor condition among the women. Next is PCOS, known as polycystic ovary syndrome. More than 10 cysts on ovaries, difficult to reverse this condition and it commonly lead to fertility issues such as infertility. Diagnosis: first one is ultrasonography, physical observation like hirsutism, menstrual irregularity and blood test. Blood tests such as LH and FSH test. And management of PCOS. It is always symptomatic management and the pharmacological management includes anti-androgen therapy or topical preparation for acne, metformin or oral contraceptives for menstrual dysfunction, insulin resistance and diabetes, spironolactone flutamide for hirsutism and gonadotropin therapy for infertility. And surgery includes bariatric surgery or weight reduction surgeries for obesity and laparoscopic surgeries. Dietary management of PCOS. Foods to eat. It includes meat and poultry, organic fruits and vegetables, nuts and seeds, natural unprocessed foods, high fiber foods and spinach. And foods to avoid includes sugar, honey, desserts, dried fruits, jams, high GI carbohydrates such as pasta, bread, white rice, white potatoes, cereals, etc. Lifestyle management of PCOS. First one is eat healthy, then taking vitamins, reducing stress and anxiety, blood sugar controlling, and losing weight. Complications of PCOS. First major complication is infertility. Then elevated blood pressure, type 2 diabetes mellitus, dyslipidemia, sleep apnea, endometrial cancer, and obesity. Do you have any idea about this symbol? Or is there any relation of this symbol with PCOS? Yes, of course. It is the symbol of PCOS. Teal colored ribbon support polycystic ovarian syndrome. September is PCOS Awareness Month and every year September 1 is celebrated as PCOS Day.